Okay, so I'm going to go over mobility, the first kind of pillar that we go through with healing process postpartum, but also mobility is super huge during your pregnancy. Postpartum mobility helps a lot. Number one, just kind of make you feel a little bit more comfortable. Helps a ton with healing, just to get some good movement. We'll work through all the ranges of motion. So especially when you're forward all the time, it helps a ton to kind of help with some of those posture changes, as well as just getting some blood flow back through those muscles and joints. Pregnancy, it's great. Again, mobility is huge. We want to have for comfort, but also as you start to get ready for birth prep, we're looking at mobility in a little bit of a different manner, that we want to create more mobility, but also that we're really mindful of the symmetry and balance as you're getting closer to those last 4 to 5 weeks. So we're going to run through kind of everything top to bottom. I have about 10 to 15 exercises that we're going to go through, working on all of our ranges of motion. And yeah, so you should be feeling good after this one. So first, we're going to start with upper back and shoulders and lats. So right arm is going to grab left. We're going to pull up and over. Make sure when you're doing mobility work that we're always focusing on taking nice deep breaths. We need blood flow to come back through those muscles. We're going to switch over to the other side. Just stretch out those lats and that upper back. All right, and then we're going to go bird flap. So I like this movement a lot for that upper back. I'm crossing and switching sides as switching the arm that comes across first. Squeeze those shoulder blades in the back. You can go a little bit slower too and really exaggerate that shoulder blade squeeze, especially if you're feeling like you're really rounded there. Okay, moving on to our hips. So we're going to go into a wider lunge, and we're going to go nice and slow, side to side, nice deep breaths. So we should feel this a lot in our inner leg, a little bit in that outer leg, but really focusing on, again, nice deep breaths, moving side to side. Good. All right, coming back up. Windmills. So my opposite arm is going to touch my opposite foot. So we're down and up, down and up. Good. Inhale as you go down. Exhale as you come up. Again, breathing. Super important when you're working and getting blood flow into those muscles. Good. One more each way. Down, up, down, up. Now I'm going to turn my front leg facing forward. My back leg is parallel. We're going to do windmills this way. So down and up. Reaching down and up. This arm can be up. You get a little bit deeper of a stretch into those hips. 3 times that way. Switch it to the other side. And we're going 3 times the other direction. Down and up. Down and up. Good. All right. Finding our way onto the floor. We're going to be on hands and knees. We're going to work cat camels. Okay, so this also will help you to engage that pelvic floor a little bit, pairing it with your breath. So nice big exhale up. You're going to bring that belly button in towards your spine, lift your hips up, tuck your chin, really round through that upper back. And then we're going to take an inhale. We're going to look up towards the ceiling, drop that belly down. Your hips go nice and high. Good. Exhale, pull that belly button in, lift those hips up. Good. Tuck that chin. Good. Inhale, up. One more. Big exhale. Pull that belly button in towards your spine. Bring those hips up as you're exhaling, and then inhale, up. Okay. Moving on. Some rotation. Thread the needle. So right arm comes up. We're going to scoop it all the way under. Reach out as far as you can, and then we're going to sit back and rest your head down. If you have a yoga block or a book, you can place it under your head so you can relax that shoulder blade. Good. All right, same thing the other way. Big scoop up. Reach as far as you can into that shoulder. So you should feel that whole shoulder blade. This feels really great when you're posture is more forward, adding some rotation, switching sides again. Take a couple nice deep breaths when your head is down. Really stretch that shoulder blade. Up, last time. Reaching up, scoop it all the way under. Good. Couple nice deep breaths here. Awesome. Okay, move that block a little bit. We're going to do some thoracic rotations. So again, hands and knees are my right arm is going to grab my left ear. I'm going to exhale and reach up, and then inhale, rotate down. Nice big exhale up. Inhale down. One more. Nice big exhale up. Inhale down. Good. Switch sides. Grab that ear. Inhale down. Exhale up. Inhale down. Exhale up. One more time. Inhale down. Exhale up. Nice job. Okay, and I call these tic-tacs. They're one of my favorites, especially for inner legs. So I'm going to be in a lunge position. My right leg is facing out. My left knee and toe are facing the wall. And we're going to lean into that and then come back out. Lean into that and come back out. Again, nice deep breaths. So working on stretching out those inner legs is super important, both pregnancy and postpartum, because they funnel right into our pelvic floor, which pregnancy, we're carrying a lot of tension down there because we have all that pressure. We're getting ready for birth. This helps lengthen out those muscles. Postpartum, those muscles get more grippy because we don't have as much core strength. And so we're really squeezing our glutes a lot, maybe doing a little bit of hip hiking. And so we're creating more tension in those muscles because we have that instability. And so working on stretching these out, because a lot of pelvic floor issues, like 90+% of them are actually caused by too much tension in our pelvic floor. So working on stretching these muscles out. Good. All right, now we're gonna go hip flexors. So pick your side. We're gonna have our, again, one knee bent, one knee foot flat on the floor. We're gonna lean into that a little bit. You should feel that hip flexor stretch a bit and back. Good. You tuck your hips underneath you. A lot of times that will open up the hip flexor a little bit more. Then we lean forward. Good. This time we're gonna stretch that leg out. We're gonna lean into those hamstrings, which those are huge too because they funnel right into it. They attach right into our pelvis, and these can get tight, especially if we're doing a lot of sitting, which is okay when you're pregnant and postpartum. Okay, switch sides. Tuck those hips underneath you, and we're gonna lean into that stretch. Add a little bit of rotation if you would like. And then we're back. Good. Now this time stretch that leg out. Keep that knee straight and then lean into, you can point your toes up towards the ceiling. That helps get a little bit more of a stretch. But again, making sure that we are breathing. Okay? All right. We have 2 now on our back. 3 actually. Okay. So on our back, if you have a yoga block, keep it close. We're going to start with open books. So our knees and our hands are facing the same direction. Our neck is going to follow that movement over all the way. Try to get that hand to the floor and then back. Okay. Rotating all the way over to the floor. Good. And back. One more. All the way over to the floor. And back. Good. Switch sides. Now my knees and hands are going to face this way. And I'm coming all the way over. Good. And back. And all the way over. Good. That neck rotates with that hand coming up and over. Giving that a bit of a stretch too. Good. Okay. Now we're going to do some hip flexors on our back. So I'm going to hug my right knee into my chest, lengthen out my, left knee into my chest, right leg is out, and roll those ankles out clockwise and counterclockwise. Nice deep breaths. And pull in a little bit more. Big breath. Good. Switch it out. Good. Pull that in. Now roll out that left ankle clockwise, counterclockwise. Pull that leg in. Good. And rest. Now grab your yoga block. Where did mine go? Oh, here it is. Okay. We're going to do spinal twist. However, I don't want you to get your knee down to the floor. I want you to have your block help be kind of that rotation here so that my knee and hip remain parallel, and I can relax here. Take some nice deep breaths. Rotation through that pelvis is always nice and yummy here. Big breaths. Good. 3 to 5 big breaths there. And then we're going to rotate to the other way. Again, I want my knee and hip parallel. Use a block, a book, a bolster, a pillow, anything that you have. Keep that knee and hip parallel so you can actually relax and get this SI joint, your glutes, your lower back, your IT band, all stretched out in more supported way. Where when you rotate too much, a lot of times you don't stretch those same muscles. You're putting it more in your joints, which we want to work on stretching our muscles here. Good. Okay. And then we're going to pick a side and roll up, and we're going to work on 90-90s here. So we're going to go lean forward into that stretch and backwards. Good. And forward again. Good. All right. We can also work on a little bit of pelvic floor strength here. So we're going to go up and down without using our upper body. So I usually have my hands in the front, or you can hold a block or your baby, whatever works. But we're coming up, all the way up onto our knees, and then sitting back without bouncing. Okay? You can work on doing 3 to 5 of those. We'll work on those in another video too. This is more of a mobility video. Just to kind of give you options with this stretch. If you want to make it a little bit more, then we're going to lean forward and back. Good. And forward. And then again, if you want to add in a few of the lifts, you can. And then back down. We're going to end with our pelvic rocks, which you all know are my favorite. So nice wide knees. We're going to sit back, take a couple of nice deep breaths. Good. And then when you're ready, you're going to inhale, rotate those hips out, and work on getting those hips as close as you can to the ground. Good. And then sitting it back again. Good. Okay, we're going to push up into down dog just for a second. Stretch out those calves and hamstrings. You're going to pick one side. You're going to bring it under into a pigeon pose. Tip here is to get that ankle and knee as close to parallel as you can. So moving whatever you need to get that to happen. And you can go on your hands or your elbows so nice and close to the ground. Be more up on your hands. You can use a block, go by your couch or your bed and add a little bit more elevation there. Whatever works best for you. Again, nice deep breaths here. We're going to flow it up. Again, down dog, stretch out those calves and hamstrings, and then big breath to get that leg up. Again, knee and hip as parallel as you can. Take nice deep breaths here. Good. And then last time, we're going to do a little bit of an inchworm. Back in, stretch out that posterior chain, touch those toes, roll back up. We're going to do 3 nice big shoulder rolls up, back and down, up, back and down, up, back and down. Awesome. Nice and loosey-goosey, hopefully. A little bit of a mobility stretch for under 15 minutes.